Supervisor Canepa, you ready to get started? We have 5:30 on our clock.
All right, thank you. Thank you very much. Let me welcome everyone to the San Mateo County Sheriff's Office of Emergency Service meeting of April 23rd, 2020, special COVID-19 meeting. May I have a roll call, please? May I have a roll call, please?
Okay, it's coming right now, sir.
Thank you.
Atherton,
Harry Weiss, present.
Belmont,
Davina Hurd, present.
Brisbane,
Erin Cunningham, present.
Burlingame,
Ann Keegren, present.
Colma, Daly City,
Len Sylvester, present.
East Palo Alto, Foster City,
Richa Avasti, present.
Half Moon Bay,
Corey Stalker, present.
Hillsborough,
Marie Drum, present.
Menlo Park,
Cecilia Taylor, present.
Millbrae,
Ann Schneider, present.
Pacifica,
Sue Vaterlos here.
Portola Valley,
John Richards here.
Redwood City,
Janet Borgens, present.
San Bruno,
Rico Medina, present.
San Carlos,
Adam Rack, present.
San Mateo, South San Francisco, Woodside, County of San Mateo.
I am here.
Great. Good evening, everyone. This is Kevin Rose with the County Office of Emergency Services. Thank you all for joining us in this Zoom meeting. We do ask of you much great appreciation to Dan Bennett and Jeff Norris that are behind the scenes running this meeting for us for the very first time. So we're hoping to get through it with 0 to none technical difficulties. To begin this meeting, just so everyone can understand, we have presentations from various individuals, and after their presentations, ESC members, we ask for your designated 10-minute question and answer to raise your hand, upon which you'll be called upon to ask your question within the time frame. I will be the essential timekeeper, and Supervisor Canepa will let you know if we're approaching the designated time limit for their respective presentations. For members of the public that are not ESC members, we do ask you utilize the chat room in order to post your questions that we will get to at the very end of the meeting. Based on time frame, this is a 2-hour meeting, and if we are unable to get to your questions at the very end, we will record them and provide answers in a follow-up manner to all of you. So at that point, if we could please, I'd like to turn it over. Welcome to introductions to Supervisor Canepa, Chair of the ESC.
Great. Thank you, everyone, for participating in this meeting this evening. Obviously, COVID-19 has struck us fast and hard. It has spread stealthily throughout the whole country. Whoever thought a virus would be so dangerous in our community? Our first health order was on March 16, 2020, directing all of us to shelter in place. All 50 states have reported cases of COVID-19 to date to the CDC. Our shelter-in-place order is an effort to slow the spread through the use of social distancing at all levels of society. Hopefully in the near future, we can implement a phased approach to help our state and local economies to reopen and get people back to work and continue to protect American lives, San Mateo County lives. I will say community members such as yourself are fighting to do good. You've all served our community well and offered many services to those in need. I know that you represent the hope and unwavering light of the human spirit. COVID-19 affects all of us at some level, whether it's big or small. Tonight, this meeting is a result of inquiries from elected members of this group wanting to know what the county and its departments have been doing in this past month. So I've heard from several board members. We hear you, and that's why we're having this meeting tonight. Due to these inquiries, I thought it's best to have a focused COVID-19 discussion to bring everyone in the loop. This is a good opportunity for an overview and for this group as a whole to ask questions. We will start with a law enforcement update by Sheriff Bolanos, followed by a health system update by Luis Rogers, our health system chief. Thirdly, we'll have Mike Callaghy give us a county update. Finally, we'll have an update by Captain Scott Kirkpatrick on the EOC. I do want to add that maybe Captain Kirkpatrick can touch upon an issue that was brought to my attention. I know there are concerns related to potential PG&E public safety shutoffs this summer. The chiefs have reached out to me on this issue. As you know, shutting off power may cause people to leave their homes and go to other locations where they are in closer proximity with other people. This may also cause those with health issues to change to another location. Also, the issue around food insecurity may become an issue. I want to let everyone know that this meeting will end. When you're done with your comments, hopefully we'll be able to get this done by 7:30. But if we need to, and to have a full discussion, we're willing to go over 7:30 because this is such an important topic. So at this time, I'd like to have our law enforcement update from Sheriff Carlos Bolanos, who really, before he speaks, has really been a true partner. I don't think not only with the county, but with the city. I know I'm in constant contact with Sheriff Bolanos in my office, and I just appreciate him taking the opportunity to speak with us tonight. Sheriff Bolanos.
Good evening, everyone. Good evening, Supervisor Canepa, members of the Emergency Services Council. I want to thank all of you for your leadership and your service. And I appreciate this opportunity to present to you the actions that we are taking at the Sheriff's Office in response to the COVID-19 pandemic. The safety of our communities, the safety of my personnel, and the safety of the incarcerated population is my top priority. The Office of Emergency Services has been staffing the Emergency Operations Center since it went operational at the beginning of March to respond effectively to the COVID-19 pandemic. The primary focus of the EOC has been securing supplies, communication, and enhancing the capacity of our medical system to respond to a surge in patients. Fortunately, we have not had to use the majority of these newly acquired resources, but they remain available to us should we see a spike in cases. In the field, the priority of our patrol staff is to be highly visible to reassure the public during these times of uncertainty. While anxiety levels are up, we have actually seen a reduction in psychiatric holds, or 5150s, since the shelter-in-place order went into effect. We are encouraging online reporting for low-level crimes, and we have seen a 62% increase in this service, the use of the online reporting. Overall, we have seen a significant drop in crime. When comparing crime reports taken in March 2019 to March 2020, we have seen a decrease of 31%. The three areas, however, where we have seen an increase are domestic violence, commercial burglaries, and violations of the public health order. Deputies responded to 58 incidents of domestic violence between March 1st and April 20th. During the same time frame in 2019, deputies responded to 43 incidents. In response to this recent increase, our personnel have produced a public information video on stress, family safety, healthy relationships, and the laws around domestic violence. We will place this video in areas where the public interfaces with us and make other efforts to draw people to it. Additionally, we will be working in conjunction with Cora to hold a Healthy Relationships webinar on March 12th, 2020 at 2 p.m. And I can provide more information to you as that date draws closer. Our initial approach to violations of the public health order was education and voluntary compliance. This last weekend, we shifted our efforts to issuing written warning citations and enforcement of related issues such as parking violations. The coast is the area with the highest number of violations. To date, we have issued over 325 written warning citations for violations of the public health order. We are prepared to issue misdemeanor citations for violations of the order if needed, hopefully as a last resort. Since the shelter-in-place order has gone into effect, we have received no reports of a hate crime related to COVID-19. Working with the District Attorney's Office, probation, and the private defender, the San Mateo County Sheriff's Office has critically looked at those in our custody to determine which individuals may be suitable for early release. In so doing, the Sheriff's Office has strived to comply with the law while balancing any risk of continued incarceration against the risk to public safety when making its decisions regarding releases. Consistent with that goal, the Sheriff's Office has continued to follow California law, specifically the California Values Act, sometimes referred as the state sanctuary law, and we comply with requests from the federal government for notification when those found to have committed serious felonies are to be released. In the last 2 months, the federal government has sought custody of 2 individuals. In corrections, recent changes in booking priorities in combination with inmate releases permitted under the law and changes to bail rules made by the Judicial Council of California have significantly reduced our in-custody population. Bookings are down 74% from February. As of today, our population has been reduced by over 450 inmates, or 46%, since the end of February. We are fortunate that our correctional system is now operating at 39% of our rated capacity. As a result, if we have a need to quarantine individuals, we have an entire floor that we're able to dedicate for that purpose. As we release inmates from our custody, our program services unit is working diligently on finding resources for these individuals. As you know, many of them suffer from addiction and mental health issues. This is difficult as service providers and nonprofits who support our released inmates are also struggling with issues associated with the pandemic. For those inmates not appropriate to release, our staff in corrections have been working closely with correctional health since January 31st to provide the safest possible environment for our incarcerated population. We have continually evaluated and adjusted our procedures. For example, the CDC issued guidelines for correctional facilities last month. However, we had already exceeded its recommendations. Anyone entering our correctional facilities must pass a medical screening that includes a temperature check. Every inmate must be medically cleared prior to moving to any other part of a facility outside of their housing unit. Inmates currently have access to tablets where information is passed on to them regarding COVID-19. In addition, members of San Mateo County Correctional Health Services provide information in person. Additionally, all of our inmates have been provided hand sanitizer, and we are in the process of providing each and every one of them face covering if so desired. Following CDC recommendations, the most hygienic way to combat the virus is to wash hands with warm water and soap. All inmates have 24-hour access to warm water and free soap. To date, I'm very pleased to report that we have had no inmates, deputies, or correctional officers test positive for COVID-19. 2 of our professional support staff that work in the correctional facilities have tested positive for COVID-19. These cases do not appear to be related to one another. Any inmate that has exhibited signs of COVID-19 is closely monitored by correctional health services and has been tested when warranted. Through telework and moving functions online, we have been able to maintain service levels with minimal disruptions. During the unprecedented circumstances we find ourselves in, I continue to be deeply impressed and profoundly grateful for the professionalism, commitment to duty, and composure under pressure displayed by our first responders and health workers throughout our entire county. The community needs us to be at our best right now, and every day, staff and our public safety and health workers, all of your people exceed my expectations and all of ours. For that, they have my deepest respect and appreciation. Supervisor Canepa, this concludes my report, and I'm happy to answer any questions.
All right, do we have any questions from any of the board members?
I do. Janet Borgens, Robert City.
Yes, Janet.
Thank you. So thank you for this report, Sheriff Bolanos. I do have a question. There was a statement that came out from disease control that said some of the positives that were tested weren't necessarily done with temperature raise. So some positives have happened and there wasn't a temperature. So other than taking one's temperature, what other mechanisms are in place to what do I want to say, secure the safety of our inmates and visitors?
Thank you, and staff, I want to add, which I
Yes, and staff, thank you.
I know you meant that. Well, it's a great question. Thank you for asking that. And I see Louise Rogers is on the call and she can talk perhaps technically about it later. But when I went to each of the facilities to check in on my people, before I had the temperature check, they asked me a series of questions in regards to symptoms that people who are infected would typically exhibit or have. So you are correct, a temperature check in and by itself, although I think it is a key measure, is not the only measure. And I'll just say that our correctional health is on top of it very well.
Thank you, thank you.
Great, are there any additional questions? Ms. Cunningham. Ms. Cunningham, you have to unmute yourself.
I was just trying to do that. Sorry about that. Thanks. Relative to the increase in domestic violence, we have had quite a few of our constituents ask, you know, how much is this and what are we doing to address it? And, you know, with a shelter in place order and domestic violence in the home at the same time, obviously it's a very, very difficult situation to get a grasp on. And the questions that I've been asked are, what are we doing with the people to remove them from further harm?
Well, you know, anytime we respond to a domestic violence call, we try to make an arrest if there is evidence to support that, and that's automatic. And then we also are very careful to provide. We also offer for every victim of domestic violence, we make a direct connection while our deputy or your police officer is at the house with Cora, and we offer those resources to the victims, and many of them take us up on it. So we typically, if there's any evidence of domestic violence, the perpetrator is arrested and booked into jail.
All right, I see Ms. Hurt's hand up. Ms. Hurt?
Thank you. Thank you, Sheriff, for the update. I'm curious about those unmute again.
Ms. Hurt?
Sorry.
Okay, thank you.
Now I can talk, huh? Thank you again, Sheriff, for the update. So my question is about those inmates who were appropriately released earlier. I'm curious if there is another county agency that you are that's assisting them on their return, since they're coming back into an environment where jobs are as they are, we're sheltering in place. There's food insecurities, et cetera, so that we don't see a cycle back.
So another excellent question. As I'm sure you know, in regards to the people that were released on the order of the Judicial Council, the State Judicial Council, they made all misdemeanors and what they consider to be low-level felonies, zero bail, which means we had to release over 100 inmates in approximately 72 hours. So although we certainly tried to make connections for those people where we could, we didn't have any choice. We couldn't, it's just impossible for us to make the connections, for many of our inmates. As I mentioned earlier, the program services staff does a great job to try to connect people with the homeless shelter, for those people who don't have a place to go. We try to make sure that they have somebody to come pick them up. We work with correctional health to provide them with whatever type of medication they may need. But the community-based organizations are stressed to the max right now, and all we do is follow the order and try to help these people out as best we can.
Thank you. I just wanted the public to understand all the stresses that all the county agencies are going through, and that we're doing everything we can, and that you guys were thoughtful about that. Thank you.
Thank you.
Great. Are there any additional questions from the members before we get on to Ms. Rogers?
Real quick, Supervisor Canepa, could I just thank the sheriff for all the hard work? I know all over the county there's a lot going on, and so the deputies are obviously essential employees. They've been working really hard to explain very difficult circumstances to folks. I know all of us have been getting phone calls. Why can't I go to the beach? Why do I have to stay within 5 miles? And all the other stresses, the calls that they have to go to during ordinary times. I just want you to know, Sheriff, that you have our support. All the deputies have our support. We appreciate everything you're doing. Please keep it up.
Thank you, Mr. Mayor.
Very well said. I'm not seeing any other hands. Is there anyone else who wants to weigh in, or are we ready to move on to Ms. Rogers?
We're good.
All right, Sheriff, thank you. Oh, Carrie?
No, we're good. Thank you.
Okay, Sheriff, thank you. Thank you so much. I know you're off to another Zoom meeting, but I appreciate your time. Thank you.
Thank you, Supervisor. And Captain Kirkpatrick can relay any questions that come up to me after the meeting.
Great.
Thank you.
Great. That brings us to item 4, health system update. Louise Rogers, Health System Chief. Good evening, Louise.
Good evening, everyone. Good evening, Supervisor Canepa. Thank you for having me. So I'll inform you about the health response and then, of course, answer your questions. First of all, I just wanted to start out by saying that a lot of appreciation is due to all of you and all of the residents of this county that collectively, through adhering with the shelter-in-place orders, and there may be a little adherence issues here and there. I know you all were talking earlier about some of the challenges out at the coast, but overall, we have had an enormous impact in this county working together. And one of the things that we look at in health is the social mobility data that is produced because of everyone is, on cell phones, and that data is very helpful. And by that data, we've reduced our activity related to retail and recreation by 60%, at transit by 83%. And there's really no doubt that this social distancing has helped prevent the spread, and it's really saved our health and hospital system capacity, which of course is one of the focuses of social distancing, is to prevent people from getting sick, and then to prevent people from needing really high levels of hospital care all at once. The goal is really to flatten out that curve of the prevalence of the disease so that we can handle and help everyone who may need hospital care. And so where we've been focused in health, of course, is supporting the health officer, Scott Morrow, with the health orders. And he, as you would expect, is quite engaged with colleagues around the Bay Area to sort out the next phase, to try to understand what the data is telling us, and to consider what comes next. And most recently, you will note, I'm sure, that on April 17th, a new order was published that does not have an end date. And that order was about requiring the use of face coverings. When people are, certainly when they're waiting in line in the grocery, waiting in line for anything, and in grocery stores, or at work when they're in hallways and not in private spaces. But the shelter in place order will come to an end, the existing one, on the night of May 3rd. And he is working with the other health officers to determine what comes next. And we believe there will be a series of additional measures that occur, changes that occur in the coming month. So now I want to just say a little bit about what we know right now about what's going on in San Mateo County and the health department's role. So right now we have 966 known cases. And, as you all know, and I think you've heard before, the level of spread in the community is far greater than the tests would indicate, because testing has been relatively constrained. And I'll say a little bit more about that in a minute. Of our 966 known cases, there are 118 that are associated with 23 different assisted living and skilled nursing facilities across the county. And this has really been one of our top priorities, is supporting those facilities to understand what's going on with their residents and to respond to it. And last weekend alone, we had a medical team that was out engaged with 16 different facilities providing support. And we also, of course, we work with the Centers for Disease Control at the federal level, and we work with the California Department of Public Health. They are the licensing entity that oversees all skilled nursing facilities. And we have been helping those organizations get their residents tested. We've been helping them get their staff tested. We've been helping them reorganize how they handle infectious disease in their buildings, how they cohort their clients, their residents, and keep people separated from each other, making sure that we don't have people who are positive in proximity to people who are not. And one of the things that we've done in this county, which is very innovative and builds on the learnings of Washington State in particular, and other places that have been grappling with these issues, is working with the health plan of San Mateo. We have created what we call centers for excellence in the care of COVID-19 patients who need skilled nursing care. And those centers of excellence have been confirmed basically to have the training and the physical layout and the concentrated expertise and the staffing and the PPE needed to be able to manage those patients effectively. And the health plan for their members, which is everyone on Medi-Cal in the county, but some other groups as well, is reimbursing those facilities at a higher rate in order to compensate for the extra work that all of this is. And as this, as the virus continues to, as the experience unfolds and we see that more facilities may be needed to have this expertise, we will add more facilities to the list of these centers of excellence. And we're also trying to proactively provide a lot of education and support to those organizations that don't have any problems yet, but could. And there are a lot of people in this county living in these congregate care settings. I think we have about 1,600 people living in skilled nursing facilities, and we have 6,000 living in different kinds of residential care facilities, or what we sometimes call board-and cares. So this is a huge priority. Testing continues to remain more constrained than we would like. There have been 9,000, almost 9,300 tests, of which 10.4% have been positive. The governor, you may have noted yesterday, announced a huge effort to increase testing by threefold. We would like to see that happen. We would like to see it happen in our region, and to have testing much more accessible. For example, I'd like to see everyone in a skilled nursing facility or in a residential care home tested. That would be a great goal. The state also published new guidance about testing, and you may know that until very recently, only people who were symptomatic and healthcare workers and first responders who were symptomatic were getting tested. That criteria is now broader. And if there were tests inadequate supply, the testers would be able to test more people. And there's also provision that if the tests were in more supply, which I think signals the governor's optimism about this, that we would be able to do surveillance testing in the community so that we would really have a much broader understanding of how widely spread the virus is, even among people who are asymptomatic. And as one of you noted earlier, yes, it is entirely possible that someone who is not asymptomatic can be carrying the virus unwittingly. And that was one of the reasons that the face covers have been ordered. So I also want to note that we've had 39 deaths, and we have begun posting the ethnicity and race data associated with those deaths on our website. And right now, the total of 39 includes 62% were white and 26% were Asian. Three of them were Hispanic, one Black, and one unknown, and so that was less than 1%. All but 2 were over the age of 60, and slightly more than half were male. I also want to note that we do have a plan in terms of testing to publish the distribution of test results by zip code. There will be some some cautions about how that data is interpreted, because of course, any place that has a facility or, a large congregate setting would find more numbers. But anyway, we'll publish the data with a good explanation that so people know what they're looking at. Another big focus of health has been working with all of the hospitals, and there are 6 in our county and some other major hospitals that we work with quite closely right outside the county, including Stanford. And we've been working with them through a series of surveys and through monitoring the actual hospitalizations and what % of those are in intensive care to figure out if we have capacity in this county for the hospitalizations that may be needed. Right now, there are 67 people hospitalized for COVID-19, and 21 of those people are in ICUs, intensive care units. And the remaining capacity that we have in ICUs, even when the hospitals are not surged, is 39%. 80% capacity in med-surg, and 80% of our ventilator capacity left. But we also worked with the hospitals to determine, how big can they get if they need to? How many more beds can they add? And that was very helpful. And then using models, there are many models, as you all have heard, for predicting surge and the increase in cases. 2 models that we worked with heavily because they were helpful at a county level, and not all of the models are, were the Stanford SURF model and the UPenn CHIME model. And after we plugged in all of the data that we got from our hospitals regarding capacity, including Stanford, which is a hospital that we use quite a lot, we were able to determine that our hospital capacity is adequate, and also that the surge that we are expecting may not happen until later this summer. And so we're in good shape in terms of planning. And also, as you all may have heard previously, there have been a lot of efforts to help the hospitals with alternatives to hospital care. Because when the surge does come, we don't want people sitting in hospital beds if they could be served at lower levels. So one thing I want to acknowledge is that the hospitals have really cleared the decks in order to be prepared for a surge. And you may even know, as people trying to access healthcare has been kind of shut down for anything that's elective. And that was necessary in order to get prepared. But the reality is it's not workable to continue going for months with people not accessing healthcare. There are very significant surgeries that have been deferred, preventive care that's been deferred, dental care has been deferred, all of that. And if we continue to do that for many months, what we'll find is that there are many people all of a sudden inundating the hospital systems for their emergency needs. And that could happen when we need the surge capacity. So we are expecting, and we're talking to the hospitals about how to loosen up the healthcare capacity for people who need healthcare, so that we're not deferring that essential care that people need. I also want to mention that we have had discharges of people who are COVID positive after successfully being treated in the hospital and no longer needing that level of care. We've had 168 discharges. And those discharges, 67% of those people went home. And the remainder have been returning to their congregate living environments, primarily assisted living and skilled nursing. The last point I want to make is, as you probably have heard, as we look at the future health orders and kind of what's needed in order to manage this virus ongoing, given that at this time there's not a vaccine for it, there are several things that are needed. And one is much more prevalent testing in the community so that we can see what the extent of the spread of the disease is. And so we're hoping that will continue to unfold, particularly with support of the state. The second is we want to make sure that we have hospital capacity and that we have a system for clearing out the hospitals when we need, and we're feeling good about that. The third is that we need to be able to trace all of the contacts of the COVID positive people. And that is something that we do in public health all the time. It's kind of our bread and butter in public health, historically, with diseases like TB, HIV and AIDS. We have used traditional public health contact tracing to figure out what's going on with the spread of the disease. And we've had a small team in public health in our communicable disease unit that are staffed by communicable disease investigators, and that's what they do. So we've increased that team by redirecting a large number of public health nurses to that effort. And right now we have about 40 staff that are focused on this. But through working with the state and their most recent survey, which came out yesterday, we're trying to estimate if the testing were to be, greatly increased in this community, how much more contact tracing would we need to do? And then working with the county, figure out, and the state actually has a system that they're standing up to help with contact tracing. Figure out how to get all of these folks trained and working on tracing the contacts. So that's the other piece that we have been focused on, is the planning for that. So with that, I think that's it for my formal presentation, but of course I'd be happy to answer any of your questions.
Great, thank you very much. I see Ann Schneider. Ms. Schneider.
Thank you. Hi, and thank you. Question on, I think you referred to the curve that we saw on our elected official briefings that showed that the tiny surge San Mateo County may have is looking like August.
There's a range. It's actually a range. I think that graph had to, it was a simplified graph. The range for the surge is really over the course of the summer. It's just that one of the models that we are kind of the most happy with predicts it in early August. But it could be in July. I mean, these models are not a perfect science.
Okay, my question was, for any of us who live in or have residents who live in what are considered high risk, we're already getting ready for pretty much sheltering in place all summer, if not longer. But as an elected official, when I talk to my public, I would like to know, as soon as your department knows, what criteria you are using. I have no problem for surgeries coming back to Peninsula Hospital. I understand all of that. But if I have to talk to people like my mom at 92 with COPD, or a child with asthma, whatever the reason they're going to be put in a higher risk category, it would be nice to have a nice logical rationale for it. And also,
A rationale for what? Let me understand this a little better. A rationale for what?
Why, as we open up society, frankly, I'm a little concerned that we're going to open up a little too quickly, because
Okay.
I have a 92-year-old at home that I know if we hit a surge and the beds are all taken, will not get through triage. I understand that.
Yeah.
So that's
So
a
first of
fear
all-
that I live with every day.
Yeah.
And I'm not the only one. There are many people out there. So I'm trying
Yeah.
to take my experience. I just would love to know what criteria the health department is going to use as soon as you feel comfortable sharing it with us, so that we can
Yeah, so
prepare
one thing I
both
would just
ourselves
say
and speak.
is that we're well aware that not having a lot of advance notice is really frustrating and hard. And that has, I mean, in the first phases, the need for urgency kind of trumped everything else. But I think, and I know that the county manager agrees with me, that, you know, we're really trying to help people plan. And there are, that's understood to be important, and we're going to try to improve that. Second of all, I would say that in case of older adults, it's pretty unlikely that there will be, you know, a lot of loosening up. Those folks are going to be high risk in the coming months, and I think it's pretty unlikely that there will be significant loosening for that population. But we'll see. The health officers are all talking together about just these kind of issues. And then lastly, in terms of hospital capacity, right now, the thinking that we have been using, and we'll let you know when it changes, but our hospitals have to be prepared for, you know, at least a 50% surge. And so they've been sitting there virtually empty right now. But we are expecting that if they get to be back up to half full, as they were previously when things were normal, that's around the time that we will start to be very careful, you know, on a day-to-day basis, literally asking that question. Should we be clearing the decks again to make sure that there's capacity for that situation that you're describing, for the other critical care needs that people have? I think the good news is that right now, it looks like, especially with Stanford having built a brand new hospital, it looks like we're in pretty good shape. But I understand your desire for more communication about that.
Ms. Rogers, thank you.
Supervisor, can I finish just one more? Only because we on the elected briefings never get to talk to the health people. This is what made me feel more comfortable. About 10 days after sheltering at home started, a doctor from Michigan put up a video together about how to bring food into the home. And I just went shopping today. It takes me twice as long. Rubbing alcohol, every package, other things, sit in quarantine for 3 days. That kind of information, because if I have to start going to a council meeting, and I've talked to our city manager when that happens, I am the person who's going to be bringing it into the home. So when you roll out, whatever you roll out, and I'm with you, and when I talk to our seniors here in Millbrae, they're okay with this. We're okay, but just help us figure out, okay, great, seniors are going to stay at home, but I'm going to go back to work. How do I best make sure I'm keeping people at home safe? And that's all. Just, you know, reach out to us for that real practical experience on that. And I appreciate it. That video made me feel I wasn't scared anymore. That simple little video.
Yeah.
Louise, maybe what you can do is maybe get back to Ms. Schneider offline. I'm going to take Risha, and then I'm going to take Davina.
Yeah,
Risha?
Ann, I'd be happy to talk to you further about this.
Thank
Sorry,
you.
go ahead.
Lovely. Thank you.
Thank you. Thank you, Chair. And what a great presentation. Thanks, Louise. When you said you would be in a position to release the test results by zip code, obviously with a lot of interpretation, help, and how to understand the data, that was music to my ears. And here is why. I have received a number of requests from my residents in Foster City. They're interested in knowing specific cases for Foster City. And I had actually reached out to Mike Callaghy about a month or so ago on this. And at that time, I understood the rationale that he shared with me for not releasing the information at the city level, as doing so may create either a false sense of panic or false sense of security. And at the end of the day, it really doesn't change anything. We were required to follow shelter-in-place guidelines, and that was what the direction was for us electeds to communicate to our community, which is exactly what we all did. At that time, there were limitations in the data, and there wasn't as much testing as it is available now. Now I understand there are constraints on that too. San Francisco has released stats by zip code. And the reason I'm raising this is I fully respect the decision made by the county and the health officer, but I'm looking for some ways on how I can explain that to our community. Our residents consider this a manipulation by government. They consider that it's condescending and shows lack of transparency. To quote, one of the residents said that the idea that somehow the people in San Mateo County are less equipped to handle this information than other counties in California, where it is readily available, is not only insulting, but also raises the question of integrity of the data that we are receiving. So I just wanted to get your thoughts, essentially looking for ways how we can explain this to our community.
I'm sorry, so I did say that we are going to produce that. So you're asking for ways to explain that we are doing it, or why we didn't do it?
So the test data would be available.
Yeah.
Perhaps a timeline on that would be helpful to
Well,
know.
so we're shooting for the end of next week. I'm hoping to have it posted by the end of next week. And it will be by zip code, but we're hoping by providing some additional data, which includes estimates of prevalence, that will help offset the problem that we were facing earlier. So it will be there, and there will be some additional information provided as well. And we're hoping that that will address the problem that the health officer had, as well as meet the needs of the community.
Okay. Yeah, that's helpful. That last part helps a lot, because the number of the cases we have had so far, if those could also be broken down by cities, is that, let me just make sure that's the
well, it's by
also.
zip code. I don't think it's going to be by city, but I think it will be by zip code, because that's how the data, that's how we have the data.
Okay.
So that's the plan
by zip code is good enough. It brings it in line with how other counties are doing. That's fine. I think the clarification that I needed, which I think is clear to me now, is that not just future data, but the number of cases so far.
Yes,
it will all be commingled.
Yeah, we're going to post all of the data that we have so far. And one of the problems is that we don't have a lot of data. So that's the real limitation. And that's one reason why we're going to publish estimates of prevalence as well. And so there will be, I think he said there will be like 4 different numbers that will be shared for each zip code. And so, I'm hopeful that this will better meet the needs. Of course, I'm sure we'll hear whether it does or not. And then if we need to go back to the drawing board, we'll be happy to do that.
All right.
That's great. Thank you.
Thank you. Ms. Hurd, do you have a question?
It actually was on the same topic. I think I got a lot of clarification. I just want to be clear, though. You will show the number that will be tested, and you will also show the positives from the testing.
Yes, the total number of tests and the number that are positive.
And then what's going to be the stated purpose on giving that information? Because I know people in our community are stating, well, this could have the opposite effect in human behavior, in the sense that now maybe folks think that, well, it's okay in my city, so I can go out and about, or I don't want to go into that city because they have problems. So has the health, have you all thought about how you're going to explain why this is important data to give out at this moment in time?
Well, I don't have the write-up in front of me, but I know we're trying to express that we feel like it should be interpreted with caution, for the reason that you say. you know, we don't want people to have the mistaken impression based on the test results that the virus is only, you know, where we have positive test results. So I think, you know, our hope is to be able to provide some written statement with it that will help the public understand, you know, what it means and what it doesn't mean.
I hope folks read that. I know I sent an email to our Mike Callaghy that I hope we wait longer before we give that information out, because I also have concerns about aggression and xenophobia when it comes to knowing who is testing positive on these things and in what areas and what cities. But I guess the information will get out and we'll deal with it then. Thank you.
Ms. Keegan.
Yes, Louise, just a couple quick questions. One, I
lost your voice just then. I think it may be muted, or?
Can you unmute, Ann?
Can you hear me?
Yes.
Okay. So I have a couple questions, quick questions. One is I have a similar concern as Davina, that once this data is released with the zip codes, it doesn't mean they were exposed even in their city. They could have been exposed elsewhere. They just happen to live in the city, and those are the results. So I think it has to be made clear that these aren't really necessarily reliable, that it doesn't mean that they were exposed within the city themselves. Secondly, you do have a data breakdown in regards to ethnicity with the people who have passed away. Is it possible that we can have a breakdown of ethnicity with the number of people tested and break that down into groups, and also positive?
So we're looking at that because the data is woefully deficient in terms of reporting ethnicity. And it's just a subset that actually have that attached to it. It's an even lower number. So it's really not reliable. The state did publish the statewide data with only 30% of the results. And I'm glad that we have a greater percentage than that. For some reason, I think it's a function of where the tests are performed and what questions they ask and whether people answer them and so on. So we are looking at that. And I believe that when the numbers are large enough, you know, that should still be able to tell us something. But we haven't, we're focused first on the zip code before we get to this. And we're right now looking at it, and also hoping that with a massive expansion in testing, hopefully there'll be way better numbers on this reporting as well.
Great, because my concern is that for the people that are getting tested, are there certain areas or certain ethnicities that aren't getting tested that maybe should be getting tested, and they may not know it's available or where it's available? So, okay, thank you, Louise.
Yes.
Great. I don't see, are there any other questions? See none. Thank you so much, Louise, for your presentation. Really appreciate you taking the time on a Thursday night. Okay, that brings us to item 5, county update. Mr. Callaghy.
Thank you, Supervisor Canepa and the Emergency Service Council members. It's great to be here with all of you tonight. And let me just start by saying what has worked in this county throughout this crisis, and that is the great collaboration of the cities with the county, all the elected officials working together, coming up with great suggestions, bringing forth information, you know, asking for more information for their constituents. I think that has just worked terrific. And that's what makes this county, I think, so different from what I hear from my colleagues from other counties. And let me just quickly kind of go through kind of the scenario of how we started this and where we're at today. And then I'll be happy to answer any questions. I think that all of you know that we activated the Emergency Operations Center on March 2nd. This was very early on. And this really is what allowed us to try to get ahead of this crisis and put many pieces in place before they were needed. You know, we were very lucky. The Emergency Operations Center was finished literally 3 months before this crisis. And it's played such an important role in how we address this crisis with everyone together. A proclamation of a local emergency was signed on March 3rd by Dr. Morrow and me, declaring an emergency. We staffed the Emergency Operations Center immediately with over 50 county employees across departments who had a variety of expertise and brought different things to the table. And we immediately established donations and volunteer units who have played a very, very important role in this. You know, the county actions, I just got to commend Supervisor Canepa and the rest of the supervisors for the actions they've taken very, very swiftly. On March 16th, the county significantly modified the operations, suspending or severely limiting direct contact with the public. On March 24th, the board passed a countywide moratorium on residential evictions. That is countywide. Then on March 24th, the board seeded $3 million to launch SMC Strong, and $1 million of that went to small business loans. $1 million of that went to the core agencies for individual grants. And I'm sorry, not small business loans, small business grants. It went to individual grants, and then $1 million to the core agencies and nonprofits themselves. On April 7th, the board passed a moratorium on commercial evictions in the unincorporated area. And then on April 21st, the board passed a resolution condemning discrimination against Asian Americans, which we had heard from many elected officials, what's going on throughout the county. And it was just very, very sorry to hear that in this time of crisis. On March 4th, very early on, we stood up a call center because we realized that many of our county residents were going to have questions. We were one of the first call centers, I think, in the state, and actually other counties have asked if they could send their residents to our call center, which we certainly allowed them to do. We later switched to the 211 system to expand our capacity. And at the beginning of this week, more than 7,400 people have used the 211 call line to ask questions. Separately, and when the orders came out from the health officer, we stood up really a different call line staffed by attorneys to answer questions. And I got to tell you, our county council did a fantastic job in answering those. You know, in regard to alternative care sites, one of the things I think that really worked for us well very early on was establishing these areas that people can be quarantined in. We had the 20 trailers. Thank you to the city of San Mateo for allowing us to put our trailers there at the event center. They were terrific about that. And early on, people had, fears and concerns about that. We certainly worked with San Carlos also to establish the federal site for those getting off the Princess ship, the cruise line, and the federal site that operated in a hotel in San Carlos. And then this county secured our own hotel, and probably again one of the first in the state, really a step down facility for those who were in a hospital. And so we created surge space by allowing people to come out of the hospital. We had our own medical staff. We took over the whole hotel in Burlingame, and thank you Burlingame for hosting us there and doing such a great job of accommodating our needs. And then, certainly to prepare for the surge in hospital patients, we were one of the first to receive a federal medical station. There was only 8 in the state of California, and we were able to get on very early. And then we had that at the event center, the capacity to add 250 more beds there, and which were established. Along the homeless front, we took immediate action on the homeless because we understood that this was going to be a very vulnerable population that we had to do something with. So we started to immediately move the most vulnerable ones into hotels spread out all over the county. And every city was very gracious and concerned and took these folks into their hotels. The county recently acquired an entire hotel in Burlingame where we're moving, again, the most vulnerable out of the shelters and into the hotel to create more space so we can get more people off the street. And we currently have about 75 of the most vulnerable population in hotels now, and we have capacity for about 60 more. So we're clearing the waiting list of folks, and we're putting these folks that are most vulnerable into the hotels. On March 15th, Verily, I remember on a weekend approached us, and we immediately said, yes, we will stand up a testing site. We immediately got a hold of the events center, and they were terrific about it. We signed a contract with the state in Verily to have one of the first drive-through testing centers anywhere around. And it's worked very well. It is underutilized, and you heard Ms. Rogers talk a bit about that. It really is a function of the test kits that are not available. Verily has the ability to do 1,000 to 1,500 drive-throughs a day, and that is the goal. We have asked Thermo Fisher to provide us 10,000 more kits a week. They are working on that. We'll have an answer next week. But I can tell you in the upcoming weeks, in the next 2 to 3 weeks, there will be an abundance of testing kits, and we will be able to ramp this up fairly quickly. All the infrastructure is there. In fact, today we put in and we requested 2 more testing centers, one in the North County and one in the South County, to augment the one that we have in place in the city of San Mateo. You know, personal protective equipment, the PPE, remains challenging around the state and certainly around the country, and also for us. We have, I believe, about $24 million in orders out there for PPE. And, you know, we expected to receive some on the 13th. We really were relying on that order. It didn't come to fruition. The person pulled out at the last minute and sold it to someone else. You know, so I think the next order we have coming in is on the 28th, but we've really relied on the generosity of many corporations, many biotechs, and a lot of you who've gone out to your constituents and said, hey, we need PPE. We've taken those donations in, we've split them up, we've sent them out. We've sent them to Seton, we've sent them to other hospitals. We certainly used them ourselves. Community effort to make sure that our folks are safeguarded. You know, we've stood up the JIC, the Joint Information Center, so that we could try to get out as much information as possible. We've done PSAs. We've really kind of tried to augment our website in different languages and doing PSAs in different languages to make sure everyone gets the message as they continue to evolve. And the latest one, that masks or face coverings are required of everyone. To date, we've had more than 70 news releases in just 6 weeks. We've got a dedicated website, www.smcgov.org, that we continue to modernize and bring new information to, and it's great information. We partnered with IEM because early on we wanted to make sure that we not only were thinking about the crisis we're in now, but preparing, what if, you know, God forbid, we had a wildfire or an earthquake in the middle of this crisis. We wanted to be prepared for that. We wanted to have 30, 60, 90-day plans and out. We wanted to really understand, what does the road to recovery look like, and set that up. We also want to understand, what does this mean for education if we're closed in the fall or for an extended period of time? And what does the financial you know, situation look like on the horizon? So we've elicited the help of many elected officials in this county, the 4 subcommittees with IEM, and they're working on that plan as we speak. Food food security is a challenge in this county right now. You know, we don't have the full extent of the unemployment rate yet. We won't have that till at the end of the month. But food security is something that we're very concerned about. And you know, Second Harvest has really stepped up and done a tremendous job. We have really identified our food czar in the county, who we are, Anna Marie Despain from the library, who's really our conduit to Second Harvest, and her team. We're working together. So we really will continue to watch that as things progress, or we expect that to get worse. The small business loan program will be launched next week. Sam Cita and Roseanne Faust and Don Cecil have done a terrific job on that, as many of you have heard of on the calls. And I think that, you know, the transparency of the calls 3 times a week, you know, with all of the elected officials, and then with the city manager and police chiefs and fire chiefs, and then with the news agencies after that, has really provided great transparency. And we constantly seek feedback on what we can do better, and how do we become more transparent? How do we to meet all of your needs and the needs of your constituents? We have the state senators rotating through. Now we'll have Phil Ting in that mix, also giving the state update, and Congressman Spears on giving that update from the federal level. So I think we have a good system. We're always looking for improvements. We're always welcoming your comments and feedback and how we can get better. But I just want to give you a small glimpse of what's gone on. And this is just a small snapshot of a million things that have gone on. I'm certainly trying to be accessible to everyone and make sure that you can get with me, and I can have answers. You can always text me, email, call me, and I try to get back to folks as soon as possible. But again, I just want to, you know, I'm certainly available for any question you have. I just want to thank all of you, because, you know, this is truly a group effort. This is a county-wide effort, and we want to reach every nook and cranny of this county to make sure that everyone's taken care of. And, you know, I thank the Board of Supervisors for all they're doing and the money that they're allocating. To date, we've allocated about $64 million of general fund money to go towards this crisis. We're certainly hoping to be reimbursed for that. We've got reimbursements into FEMA for that. So, they reimburse 75%. But we'll continue to watch that and continue to try to meet the needs of our folks. And this would be, again, I think Ms. Rogers talked about this. This will be really a long recovery. It's not going to be a short recovery. It will not be a flip of the switch. It will be a gradual reopening in trying to get us back together. And even that new normal will look like, still social distancing and face coverings and washing the hands for a long period of time. With that, I'll stop and be happy to answer any questions you may have.
Great. Thank you very much, Mr. Callaghy. Are there any questions for County Manager Callaghy? We don't have one question for the county manager. Is that correct? All right. Mr. Callaghy, yeah. Mr. Goethals.
I just want to give everybody the opportunity to thank Mike for what he's doing right now.
Yeah, that's right.
Mike, we love you so much. You're our leader, and we're all looking up to you, and you're doing all the right things. Thank you.
Thank you.
Yes.
Thank you, Mike.
Thank you. I
Yes.
appreciate it. Thank you.
Ms. Borgens?
I was going to say a similar thing. I'm just amazed at the leadership that is coming out from our county leaders, supervisors, the county manager. Certainly this is a collaborative effort and we cannot do it without the partners that we have forged. I think the one good thing of many that's going to come out of this is exactly that. The way we have learned to truly work together and come together for these difficult times. So thank you for your leadership, Mike, on this. And I look forward as we move forward.
Great. Thank you very much.
Mr. Sylvester.
Hi, thank you, Supervisor Canepa. I just wanted to make a comment.
I think we lost you.
Glenn, can you unmute your mic?
Okay. Thank you. Can you hear me now?
Perfectly.
Great. Thank you, Supervisor Canepa. I just wanted to put in a word for Mr. Callaghy. Myself, and I'm sure a lot of folks on this call participate in the San Mateo County calls with Mr. Callaghy. And, I've gotten to a point that if I don't hear his voice, I will begin to go through withdrawals. And I'm kind of glad he's here. So again, kudos to you, Mr. Callaghy. And you did bring up one topic, and that's the area of food. And please, we're still waiting up here in North County. I know we're getting some, but I've come up with a great site and we need to move forward so we can at least address some of our folks up here. We'll be covering a whole bunch of cities, not just Daly City. Unincorporated Broadmoor, Coma, Pacifica, parts of San Bruno, where folks come to shop at Ceremony. It's desolate. And we need to get moving. I really don't want the folks to start revolting here, because when you have traffic backed up for miles just waiting, we need help. So
yeah. Mr. Mayor, I think it's a great suggestion. I think that, I'll check on that tomorrow and see where we're at with that. I think the Second Harvest was amenable to that, and I'll see what their plans are moving forward.
Thank you, Mike. Keep talking. That's all I have.
All right, Ms. Chuang.
Thank you, Mike. I join my colleagues to thank you and the county staff for doing a tremendous job. I think that the information that you have passed on have established the trust among us that you're accessible and you're ready to answer questions. So I'm grateful. And my question is this: I help with the Second Harvest Food Bank in some of the food distributions. And this could be just a technical part of it, is that these days, all the clients are now driving through. And what we often found with the volunteer is that you open up the trunk and there's everything. And it sounded like that they live there, or they have the car seats, or they have, construction, work. And so it takes time, and it makes the volunteers, it makes it harder for them to go through the line and to be able to put in the box produce. So I wonder if Anne-Marie could work with the food distributions, and then perhaps just a reminder to the clients in terms of before they get into their car, could they just, kind of put away a space so that they don't have to get out of the car? And so the volunteers will be able to put the things into their car without, putting them in a positions where there could be a social distancing issues and that kind of thing. And also the other part is, if there are, I know that you said there are close to 1,700 volunteers signing up. And I wonder if there's opportunities for the volunteer organization, the nonprofit, to come up with some kind of sort of instructions or some kind of a heads up, posted either in the kitchen or in the food produce or wherever there are. Because what some of the seasoned volunteers are finding is that it's exhausting when you have new people coming in, and then they need to have to explain to them, because these new volunteers are excited, they want to be helpful, but they need a lot of instructions. So those are things that we probably will be able to work it out at the front of it, so that it's a much more it's a smoother transitions for everything to go through.
Yeah, excellent suggestions. I mean, you certainly you being on the ground and involved in that, really, you're able to see these things that otherwise we just wouldn't see. So excellent suggestions. I'll bring those back to Anna Marie.
Thank you.
Great. Seeing that there are no questions, did I miss anyone? All right. Hey, thank you very much, Mr. Kelly. Appreciate your report and continue great job. So that brings us to item 6, EOC update. Captain Scott Kirkpatrick. Mr. Kirkpatrick. Captain Kirkpatrick.
Good evening, everyone. Emergency Services Council. I really wish I didn't have to follow Mr. Callagy, but that is my fate. Just want to talk real briefly about EOC operations, the plans and projects that have helped us with this COVID-19 response. Some of the things that we had to place on hold and contingency planning. So we, as you all know, being our governing body, that we moved into this new regional operations center in January, and we were kind of hoping to settle in a little bit, but the pandemic had other plans. So a mere 2 months after kind of moving in here, and before we were able to stretch the equipment and check everything and make sure that we had enough supplies for everything, we were in a fully involved operation. And so what that did was, any new building is going to have some growing pains, and so one of the things we had to do is to kind of supplement the technology that was in here and untested. And as we used it under fire, we learned that some of the stuff needed some more attention. And so our staff had to actually jump in and really help out with that. Specifically, Dan Bennett and Jeff Norris really helped us technologically, make sure all the systems work, make sure that we could support the county as all the county departments came in here to help us manage this incident. The other thing that the group here really had a big part of is when we first set up the activation. Nolene Powers, Jeff Norris again, Mike McKeon, Paul Lim, Dan Bennett again. They've all taken really important roles, and they've done you proud as our governing body, and they've done me very proud. And we've really done a great job of supporting the county here. Some of the things I just want to touch on really quickly. And I know the supervisor wanted me to talk about this as well. In preparing for the PSPS season that is coming upon us, unfortunately, and how we're going to deal with that while we're in shelter in place, and we don't know exactly what the summer is going to look like. We know the fire season is coming again. So we're really taking kind of a two-stage approach, or a two-direction approach to how we're planning for that. Of course, when this first the pandemic first arrived, and we were super busy just setting up the infrastructure that the county wanted so that we could support the county health. and make sure that we were able to handle any surge capacity to deal with our homeless populations. And we continue to work through many different issues. Most recently, we've come up with a plan to reach out to the farm workers so that we can make sure that they understand, what social distancing, and provide them with PPE if needed, and the proper ways to don and doff things like that. But one of the ways that we're looking at approaching this summer with all the impending possible activations with public safety shutoffs and fire season is I know that the county manager has hired a contractor to help us formally plan for a secondary disaster, because we don't know how long we're going to be in this state. We don't know how long we're going to be in shelter in place. And one of the objectives of that is of this contractor that's already been hired, is to prepare us for the secondary disaster, which, although not technically a disaster, the public safety power shutoffs that we all lived through last summer, we all know they technically really are disasters. And the other thing is, now that we've got this infrastructure set up to deal with the pandemic and the potential surge, and make sure that we can care for the people that need it in our hospitals in regards to this pandemic, with that infrastructure set up, it frees some of our staff up to turn their focus towards these upcoming events that we know are going to be upon us within the next couple of weeks. So some of our staff is going to be reassigned and really focusing on public safety power shutoffs and the fire season. We're embedded here with CAL FIRE, so we're able to have those conversations with two of the primary groups that are going to be dealing with those issues this summer. And we've already begun that. And I just wanted to take a real quick second. I know everybody's bearing with this, but I just wanted to reach out, or just wanted to recognize all of my staff here, Kevin and Rose and Mike McKeon and Paul Lim, who were integral in the beginning of the setup for the EOC, Jeff Norris and Dan Bennett, with all their technical expertise and their assistance with anything that we don't know how to fix. We call those guys, and they're the guys that get it done. Chris Coe, one of the managers here, has done an outstanding job as the watch officer. Sergeant Ken Clayton, assigned here in the Emergency Services Bureau, has been kind of leading the way for the law enforcement branch of this. Brian Mulver and Nolene Powers and Mona Vassilo and Jan Peterson, Bill Riley, they've all done critical parts of our response to this pandemic. And just wanted to let you know that they've done you proud, and I'll leave it at that since we're kind of late into the evening. But I'm available for any questions.
Are there any questions for Scott?
I have one. This is Janet Borgens, Redwood City.
Yeah, Janet.
So you touched a little bit on the PCPS, the shutoff. So are we going to discuss that further in the agenda, or do we discuss that now?
I think it's an appropriate time to talk about it now, Janet. So if you'd like to continue, please go ahead.
Okay, thank you. So I have some concerns. I really do believe that at this point we need to maybe encourage PG&E or direct PG&E to take a step back, only because as more people shelter in place, it is their children are dependent on utilizing computers. There's more people utilizing electricity. There's more need for oxygen dependent at home residents. I'm just really concerned that and even food storage, I'm concerned that if there isn't a need, and I would leave that up to the experts, which would be our fire personnel and our safety personnel. If we could take just a step back to take a breath during this time and maybe delay some of those shutoffs during this time until we can at least release some of the stay-at-home stringence that we have in place now, because I am concerned that will adversely affect and cause a bigger problem than we currently have. So does that make sense?
It makes total sense. Scott, is there anyone from the chiefs throughout the county there on the call, or is there anyone who could speak on this issue? Scott?
I'm looking to see what chiefs are on the call right now, sir. Ari DeLay is on
It
there.
looks like Dave Pucci's on.
Dave Pucci. I don't know if either of them are prepared to talk about this.
Okay. So Ron Myers from North County Fire had reached out to our office and had expressed some of the concerns that Janet has. And I don't know if there's anyone else on this call, if the fire chiefs had from your different cities or towns have reached out to you, but it seems to be a great concern. And one of the concerns is if there is a power shutoff, where do you put folks? And so obviously we have a shelter in place, and I think there's a lot of concern around that. I'm just curious from any of the members if they've heard from their chiefs relative to this issue.
I think Chief Pucci might be willing to speak about that. Let me see if I can find him here on the screen.
Hi, I've unmuted. Can you hear me?
Yeah, we can hear you. Thank you.
Sure. The concern from the chiefs, I guess, is twofold. One is going to be the necessity. So we can have fire weather in San Mateo County. We can have dry weather conditions, and ordinarily those are a concern for us. One of the things that we lack in this county is significant fire history. So fire weather in San Mateo County, while it can be severe, is not the same thing as if we were to have similar weather events in Butte County or any of those other counties that do have more frequent and more severe wildfires. So it's not that it's not a concern, but in the context of PSPS, we question the necessity of doing it at all with the downside of the PSPS, just because mainly that lack of fire history in our county and our ability to contain fires when they do break out.
All right, thanks, Chief. Did anybody have any questions for the chief or for our staff?
Well, I do.
Okay, Gary?
Yeah, Chief, are we doing at a time like this, are we doing any preventative or additional preventative measures so that if there is shutoffs that we're more prepared than we would probably be traditionally, because we're not maybe focused on that right now?
Well, I think we could look at last year's model when we had the PSPS and the fire weather to go with it. And I can't speak for all departments, but we do look at the weather and how long the conditions will last. And we can look at upstaffing, we can look at patrols, as well as just various surveillance models that we can do to aggressively jump on a fire once we see one or have one reported. Additionally, the response changes with the weather too. So you have a reported grass fire on a day that's 60 degrees with high humidity, you have a relatively small response. If you have the same reported fire and it's 95 degrees with 20% humidity, you get a much greater response. And those systems are already built into our countywide automatic aid agreements.
All right. Sue Vlatterhouse, Ms. Vlatterhouse?
I just want to say I agree with everything that Janet said. Ron Myers is our chief, and we have all discussed this and think that it would be a tragedy if we had PSPS during this shelter in place. So thank you.
Okay, I have Glenn Smith, Mayor from Daly City, Glenn Sylvester.
Thank you, Supervisor Canepa. I just wanted to provide a comment. I completely agree with the chief. PG&E has created PSPS and have put down certain requirements, combination of humidity and etc. I think they are they basically have gone to the highest extreme so that they can do PSPS. Given what the chief said, given the history of potential fires in San Mateo County, I feel if we can have PG&E relax, not take away, but relax some of the conditions, I think that would go a long way. I would rather err on the side of caution than to say not do PSPS at all. I would not want to take that chance. Thank
Got
you.
it. Thank you, Mr. Mayor. That brings us to, I have Ann Schneider, and then we'll take Marie Chuang.
I'm trying to figure out how to unmute. Hi, I just dawned on me that for the long-term planning for the county, of which I serve on that committee, we've looked at power shutoffs, but we haven't looked for those very rare, extremely hot days like we had over Labor Day 2-3 years ago. So since we have the fire chiefs there, some cities have more per capita air conditioning than those of us here in North County. We don't tend to have a lot of air conditioning here. And if we have power shutoffs, our residents are going to be much greater at risk. Also, I'm doing a lot of studying right now about particulates as they relate to morbidity in COVID-19. The one good thing, the only good thing about this right now is a reduction in air flights, which means a great reduction in particulates, yay, and noise. But we run a HEPA filter in here on bad air days to absorb particulate matter. So we just might want to keep in mind, if we have a fire episode or a power shutdown or those extreme heat days, that particulates are a problem. Thank you.
All right, Ms. Chuang, and then we'll go to Mr. Mayor Medina from San Bruno.
Thank you. So my question is for the chief. Do you know if PG&E has regular trimming and maintenance, and that does require at times for them to shut down the electricity for an afternoon to a whole day? It really depends on the scope of their work, but they do have them pre-planned. It's not, so my question is, does that help with the reductions of the PSPS? I know there are many factors involved with the PSPS, but one of them is about the down trees and the limbs and all these vegetation maintenance. So do you know if they have planned this ahead of time? Because the vegetation maintenance can be planned ahead of time.
Yes, and I couldn't speak for PG&E, but I can share with you what the information that's been shared with the chiefs. And that is that they do have a program where they're clearing the space around power lines and transmission lines. And that is part of their program, in addition to hardening their infrastructure to reduce the likelihood of a PSPS. The information I received recently from PG&E also indicates that they are planning and working towards, if there is a PSPS in our future, that it will be shorter in duration and more focused.
Thank you.
Mr. Medina, Mayor Medina.
Thank you, Supervisor. Just a couple things on this note. I know we had a telephone pole on Crestmore Drive that needed to be replaced, and it was not crucial, but notice was going out that there was going to be a disruption in service up to 8 hours. I made a call because, again, with our situation and what we're all in, that could be very disruptive, and food and everything else that's there. So I think if it's not a necessity, I think PG&E needs to be more mindful in those broader scopes of average daily work. And secondary, when we had the first shut off, where the supervisor and I were at the EOC in the county, it was very broad based, and there was throughout many of our communities. I think the second time where we were on standby and then they said, it's okay, the wind has died down. Hopefully that they're being more mindful and looking at it very faithfully and looking at truly what they have to shut down. The thing, just losing medications, losing all the food, having nothing to do, but we're saying don't leave the house, and other avenues that people had to here and over town at the mall was on and lit up. However, you walk across the street to all of those complexes, they were all closed down. Well, now they'd all be in the same boat potentially. So I'm hoping that PG&E also has learned some things and is being more cautious, being more careful, being more mindful when we're dealing with what we're dealing with today with the virus that's facing us all. So thank you.
Are there any other questions from board members? Chief, I have a question for you. What can this board do to support it? There seems to be support on this issue. What can we do to support your work? Does this go before the the CPUC, do we have the authority to write a letter? Do we have to pass an item? Obviously, this is important to the members. What can this board do to support the chief's work throughout the county?
I appreciate that. We just began talking about this at the chief level right now, and I'm not sure what the most effective way is. It could be a letter or resolution from the County Board of Soups, something along that line. The chiefs will be meeting again on Tuesday, and I can get direction from the group on how they think we could best be supported to push this forward and get back to you. Great.
Yeah, if that would be great. I think, we could talk about it. I think coming from the OES board, whether it's a letter or whether it's a resolution, because the OES board really does sort of speak for the county and its representatives, may be an appropriate place. But when you decide and the chief decide, you just advise us on the best way to proceed. Okay.
I would agree with that. We can bring that back to you after next Tuesday.
All right. Thank you so much, Chief. Are there any additional questions on this item?
Supervisor Canepa?
Yes, sir.
Yeah, hi, this is Kevin Rose with OES. We do have some updated information regarding this. We just learned this week actually that CSAC, the California State Association of Counties, is involved in emergency rulemaking at the CPUC related to PSPS and COVID-19. I guess there's been a filing, something that we could follow up with, and with your colleagues as well that are on the CSAC board, Supervisor Groom and alternate Supervisor Pine, and we'll make this available to the ESC as well. We have provided some feedback just to the ESC as a whole with regards to what the captain referenced that we are continuing to do and starting back up. As you all recall, in December, we had after action debriefs after the October events. Gathered all that information from your feedback from the cities, from county departments, from OES, and had a December meeting with PG&E providing all of this information. We were scheduled to have a March meeting that PG&E was going to be coming back to us with what changes they were going to be making with regards to the events, because absolutely to the chiefs and to Mayor Sylvester's point, as I referred to it, we were essentially we were a collateral county. The requirements that the PG&E set, we didn't really necessarily see that. And one of the things they have referenced is quote, micro-targeting. We were supposed to have a follow-up meeting in March that had to be canceled because of COVID-19, but we have asked PG&E to provide us some information with regards to what they may be changing. And then even as of today, that they themselves are starting to write contingency plans with regards to should there be an activation with COVID-19. But absolutely, Supervisor, to your point, this is at the state level, this is CPUC, but we're more than happy to provide a letter of support with regards to CSAC's actions.
Okay, great. Really, really appreciate that. That's moving us on. We're going through pretty quick tonight. Item 7 is public comments, questions. Madam Clerk, do we have any public comments or questions?
We are currently showing no questions on either the YouTube channel or on the main feed. At our peak, we had 9 viewers on YouTube, and we have 33 participants at our peak on this channel.
Did you say 9 or 150,000? I got confused.
I probably misspoke, but I thought it was 9. We do have a question just now coming up from Ann Schneider.
Let me hit Adam Rack, Mr. Rack.
Oh, no, I didn't have a question. I was laughing at your joke.
Well, hey, you made me feel good today, Adam. All right, Ms. Schneider.
Is this, I'm sorry, I'm jumping between both meetings. This is where we can talk about comments related to COVID, or should I hang on to my comment has to do with particulate, Supervisor. For everybody on the call, you know I work in the environmental field. I'm getting so many emails every day with the relationship between people who live in areas of high particulate pollution and their susceptibility to COVID. Given that we're going to be living in this environment possibly for 18 months, given the time it will take to get a shot. I'm forgetting my vocabulary. I just hope that we will continue, or for Emergency Services Council, that we begin to look at these slow killers like particulate matter It can be compounded in heat waves. It can be compounded in no wind days. I just want to throw that out there because they're finding that relationship. And sadly, and I haven't been able to report this out, I went to my first UC David Aviation Emissions and Noise Conference in the very end of February and March. And it turns out that airports are, number one, first great greenhouse gas generators, but also a source of ultra fine particulates. These are smaller than 2.5 microns. And that gets really deep into the lungs, and COVID affects the lungs. So I know we can't do it now. I just don't want to lose us from looking into these long range environmental disasters on that. And there's no data coming out specifically for it. And I had this written somewhere. Those of us who are close into the airport will be subjected to certain types of particulates, but the entire county is subjected to these ultrafine particulates. And I think it's something we really need to be keeping an eye on for the health of all of our residents and for the creatures out there too.
Kevin, can you have an offline conversation with Ann about this? And I don't know, Ann, if you've talked with Kevin and the staff, but if you don't mind doing that, Mr. Rose, that would be
I would love to put, oh, I'm sorry, Supervisor.
Yes, sir, absolutely.
I also had reached out to California CARB staff up in Sacramento, and they had given me a bunch of new information, and then COVID hit, and I haven't followed up with it. So I have this collection of data, first and foremost being the biggest problem, the lack of monitoring devices in the county. So this is our opportunity to start setting up, starting to collect data that we can use.
Okay, and also remember, Ms. Hurt is the city's representative. I'm sure Davina will be more than willing to help with air quality issues and working with Ms. Schneider, right? Ms.
I'm
Hurt?
happy to talk to Ms. Schneider about all the great work that's happening at Bay Area Air Quality Management District Board. And Supervisor, you're there as well, so we can give her double the information.
You are correct. You are correct. Okay, so do we have any other questions?
Yes, Supervisor.
Mr. Sylvester.
Thank you. Hearing Council Vice Mayor Ann Schneider on the line, you know, I was concerned about particulate air, especially when we had the fires. And I requested that in the budget, OES think about stockpiling some masks. And we heard from the health officers or the health community that it was not a good thing. Well, if it wasn't a good thing then, why is it a good thing now? I think we need to revisit and consider stockpiling or the obtaining of masks. They don't necessarily have to be N95, but masks. They can be surgical masks, which are probably much cheaper, but I think we need to revisit this. I do not have a crystal ball, and I did not know COVID-19 was coming. But if we had masks, I think this would have been a little bit easier for our healthcare professionals, law enforcement, our first responders, that we had to supply should a city need them. So just a comment on that, that's all. Thank you so much.
Thank you. Is there anything else? And I guess, Mr. Rose, you know, Mr. Sylvester does make a good point. We had someone, you know, they were speaking to us about the masks. We were told that the N95 mask, and when it came to wildfires, wasn't the most, you know, the most appropriate tool. You know, at the time, it sort of made sense, but now it seems as if, and I know masks come in different, different sizes, shapes, and forms, but now they're encouraging everyone to wear masks. So maybe what we can do, Mr. Rose, is we can sort of, you can work with Mr. Sylvester, but maybe that's something that should come before the board, and we should make the determination on, how we want to move forward with the masks, or not move forward with the acquisition of masks. So with that, are there any additional questions?
Supervisor Canepa, I don't have a question. I just want to say thank you to everybody. I apologize. I haven't really been able to chime in, but I'm out here right now giving out hot meals in the community like so many of you, it's so important that we take care of our community members. San Mateo County is doing some amazing work. Thank you for your leadership and thank you for everything that everyone's doing.
Well said. Thank you. Is there anything else on that positive note? Okay. We have item 8, next steps, meetings, bi-monthly updates. I've heard from a couple members and I need some guidance and direction from the, our next meeting was going to be planned for June 18th. Some of you, where are we landing on this? Could someone provide me guidance on members' thoughts?
Mr. Supervisor, this is Rico from San Bruno.
Yes, Mr. Medina.
In light of all that is transpiring, and this group also is trying to ensure that the secondary disasters that may and someday will occur, and hopefully not during this time, I think it's important for us to be updated. This meeting is going to end before the goal of the 7:30 that you had wished. I think it's important for things that are moving that we meet, maybe schedule ourselves for May 21st as an example. We're already scheduled for June 18th, as you said. At the June 18th meeting, we can evaluate whether we need to meet in July. I think it's an important factor for us to hear from some of the health and the other elements that are being brought into this discussion that we don't hear on the electeds phone call. But I also want to be mindful of staff. So if the county manager doesn't need to be at this meeting, because I'm sure he has plenty of Zoom meetings and there's other stuff that can be given to us, sent to us, I think that's fine too. But I think it does not hurt this body that this is what we're formed for, to meet during these times and to ensure that we can tell our constituents that we are operating at full force and we are being led well.
All right.
Thank you so much. I'll have to concur with Mayor Rico Medina. Well, because I'm a people person and I love you all. And I think we need to meet, especially during this time. Waiting every quarter is not good. I think we need to, at a minimum, meet every month, or if we can go every 2 weeks, I'd even go for that. But anyway, every month at a minimum, and I'll definitely take and accept whatever the group wants to do.
Okay. So I don't know if there are any other comments from members.
I just want to agree to Supervisor Canepa. I think that's a great suggestion that we get together once a month, even if it's half an hour, just so we know, fluidly what's going on. Thank you.
So, Supervisor Canepa, I'd agree also with Mayor Medina's proposal, but I like the idea of maybe let's review in June and just kind of see where things are, and we can assess at that point.
Yep.
I agree too.
I agree.
Is there anyone who disagrees? All right, so I think I think Mayor Medina's suggestion is a good suggestion, and I think you echoing the support for that, Adam. I think the rest of the board is there. I think we should do that, and then after June, we'll just make we'll make the assessment to see if we want to move forward or go back to our regularly scheduled meetings.
Just so we're clear, we're going to May 18th, then June, and then reassess and see if we're going to continue monthly or go back to our quarterly.
May 21st.
May 21st?
May 21st. I think May 21st is a Thursday, I believe.
It is.
All right.
Today's Thursday.
Yeah, today's Thursday. So are there any other questions?
Sorry, just a quick explanation to the ESC body. The June meeting will be the budget meeting with the email that was sent out to you. So we still have to vote on that fiscal year. Absolutely, we'll hold the May meeting, but just so everyone knows, the June meeting, we will have to have that budget vote.
Well, I think, I'm sorry, Supervisor, I think not only that, but there was the JPA that we'd like, if possible, to move forward as well, that the subcommittee has met and is prepared to bring back a recommendation. So yes, there would be business that needed to be conducted. Maybe we, have time for COVID-19, but I'm sure we can get through all of that.
Thank you, Mayor.
All right. Are there any additional questions? I want to wish you a happy Thursday night. Hope everyone's in bed by 10. And until our next meeting, okay?
All right.
Good night,
All
all.
right.
Thank you.
Thank you.
Good
Thank
night.
you.
Night.
Night.